So I'm Alon. I'm running Mind Ventures. It's a mental health venture fund, which is backed and seeded by the Black Dog Institute. We invest in the full spectrum of mental health, from clinical illness to subclinical to well-being. And really we focus on the intersection of tech and mental health.
Very cool. It seems to be a big topic of some of our digital health startups here. What are you seeing in the mental health space? And how are you seeing digital health kind of serving some of the problems we're seeing in mental health?
Oh, it's probably serving all of the problems, right? So we are trying to focus on scalable and affordable and accessible solutions. So anywhere from new modalities of step care to hardcore technology like psychedelics and AI and new LLMs and TMS and a bunch of other technologies, anything that could put some scale behind it. And our shtick is that it needs to be evidence-based. We're in partnership with the Black Dog Institute. So we are really focused on digital solutions in healthcare and mainly mental health. So being here and seeing all the innovation around here is absolutely incredible.
Cool. And I guess there's a lot of solutions that a lot of startups out there. In the mental health space, what do you think makes or breaks some of these startups, some of these new ideas, based on what you've seen in the space?
Yeah, that's a great question. I reckon you need a good understanding of the ecosystem and the payer ecosystem. There's a lot of important solutions out there and important problems to solve. But without a deep understanding of the payer ecosystem and who's going to actually pay for your product, for your platform, for your solution, it will be very, very hard for you to monetize it.
Amazing. And I guess we've seen there's a lot of people talking on panels. Have you had a chance to jump on any of the panels at the festival?
Yeah, I moderated a panel about, surprise, about the future of mental health. I had 3 other founders with me in the psychedelic space, robotic space, and VR space. Really to explore these new technologies and how they impact mental health care and effectiveness and efficacy, and really tap into the potential opportunities in mental health in a way that is slightly controversial.
Yeah, I like that. Tell me something controversial.
If
you can.
It is hard to monetize it.
Okay.
And you need to find the right payers that have the right mindset as you.
Why is it hard to monetize?
It's a bit controversial, but insurers are some of the biggest payers in the ecosystem. And insurers have a fee-for-service model, which doesn't always align with early intervention. So you need to have a slightly different model, which is called value-based care. So if you believe in value-based care and your strategy is centered around value-based care, then you will probably tap into mental health, because a lot of the solutions are early intervention and detection and prevention. If you're just fee-for-service, it can create some challenges because you're not genuinely interested in solving it, because the more it lasts, the more you get paid.
Interesting. And what about direct-to-consumer? Do you think there's a market out there for startups who want to market directly to the consumer, to skip the insurers, skip all that?
Yeah, part of our thesis is centered around the fact that consumers or patients sit at the center of any mental health product. From a data point of view, from an engagement point of view, and you really need them to engage deeply with it. But we're trying to separate the business model to the product, because there's not a lot of consumer apps out there that people pay for. So, and they might pay for mental health apps, but we do try to think about it holistically and identify the right payers at the right time for these apps, while not taking eyes off the ball and really delivering an amazing UI, UX journey for users.
Yeah. And I guess if you could wave a magic wand for Australia and mental health new apps coming out, or what would you want to see in about 5 years at this festival?
At this festival, to be honest, it's actually quite amazing. Really, really good. I want to see more folks here. I want to see a new generation of digital health companies that are big and really transforming the ecosystem. We've seen it in SaaS and fintech over the last 15 years. I really want to see it in healthcare as well. What I would love to see more is more corporates and traditional healthcare providers engaging with more digital solutions in a deep sense, not just part of their innovation team, really core part of their strategy. I think we're seeing some progress, but I want to see a lot more, because this is really the future to really tap into, to really be able to solve some of the biggest issues in mental health, accessibility and affordability. The only way to do it is with technology and through new integrations and new solutions.